today we'll talk about chromosome analysis, what it is about, how is it done, and how to read the result from a chromosome analysis. Hello, welcome to Dr. XY's channel. I am a board-certified clinical laboratory geneticist, and I like to go over anything fascinating and useful about genetics on my channel. Chromosome analysis, so the gist of it is to look at chromosome under the microscope. How do you get chromosomes? First of all, the cells has to be alive. Our genetic material is packed in our chromosomes but in majority of the moment in our life, if you take any given cells, look at the cells under the microscope, you can't see the chromosomes because they are stretched out in the shape of chromatin. They won't condense unless the cell is actually dividing and it's in the particular phase of the cell division. If you've done genetic testing with some commercial companies like 23andMe, maybe they ask you to just take a buccal swab or just take a spit. So those won't work for chromosome analysis because you can't really make those cells divide effectively to see the chromosome. So blood is the most common sample for chromosome analysis, and occasionally your doctor might have the reason to sample skin biopsy from you. Skin can also be cultured and they can divide in the culture, and then we can do all sorts of analysis with them, including chromosome analysis. So now these are the sample types. Live samples that can divide happily in tissue culture, so blood or skin. Then once chromosomes are obtained, the cells are dropped onto a glass slide, stained with a special stain. And these stains will give the chromosome banding patterns depending on the underlying sequence of the chromosomes. So every chromosome will have its own banding pattern, almost like it's the zebra of its own shape. You have light band, dark band, gray band. And so the sequence of them are not random. Using that, we can then recognize which chromosome is it and is it normal. So that's the gist of chromosome analysis. If you get a result that tells you there is an inversion, it means that part of the chromosome is flipped within itself. There can also be translocation. That means that one piece of one chromosome has swapped position with another piece. So usually if you are phenotypically normal and you have problems, and most common would be recurrent pregnancy loss or infertility, some pretty common result you will get if it's abnormal, and it would be translocation or inversion. There are rearrangement out there that are known to be benign. For example, inversion 9. I talked about it in the previous video. I actually asked ChatGPT what inversion 9 is. It explained it technically all correct, but it couldn't really give a good explanation to what does this mean for the patient. So I guess it's just being careful when it comes to health information. Yeah, so that's chromosome analysis. Test and true method used pretty much in all genetic labs to look at structural rearrangement. So that's it for today. Thank you so much for visiting. This is Dr. XY, and I will see you next time.